Hello, everyone. Dr. Kobler here, the urgent care doctor. And today we're going to discuss the case that I have been alluding to since my first videos came out. The case where I extracted a cockroach from a patient's ear. It's not going to be too graphic, but if you're sensitive to uh, bugs or the topic of bugs, then you may want to avoid watching this video. For everyone else, this is the time where I had extracted a cockroach from a patient's ear. I am going to go through the patient case, what I saw, what I did, and some other information so that you can be informed about what to do when you have a cockroach in your ear, or anything for that matter in your ear. What I describe in this video has no patient identifiers and is for the purposes of education and entertainment. With that being said, let's get started. Before we dive into the case, it's important to understand the anatomy and the function of the ear. Once we have this under our belt, it will be easier to understand the patient case. There are several ways to understand ear anatomy and function. The easiest way is to understand from the outside in. The ear is divided into three different parts. The external ear, which consists mainly of the outer ear through the external auditory canal to the tympanic membrane or eardrum. The middle part of the ear, which comprises the eardrum to the oval window and round window, and is composed of the auditory ossicles, or the three small bones of the ear, which are called the malleolus, incus, and the stapes. The internal ear is composed of the vestibule, the semicircular canals, the cochlea, and the vestibulocochlear nerve, or cranial nerve 8. The ear is divided into the auditory system and the vestibular system. Each system corresponds to the two main functions of the ear: the auditory system for hearing and the vestibular system for spatial orientation and balance. The auditory system, or the hearing system, allows us to detect, process, and interpret sounds. It enables communication and interaction with the environment by allowing us to perceive sounds, understand language, and localize sound sources. Hearing is accomplished by mechanical sound waves traveling through the ear canal. These sound waves cause vibrations and movements inside the eardrum and the auditory ossicles that are then transmitted into the inner ear. These sound waves and mechanical movements are then converted into electrical signals that are transmitted from the vestibular cochlear nerve to the brain's auditory cortex. The vestibular system allows us to maintain balance and orientation throughout the day. It detects head movements and gravitational forces within the inner ear, providing essential information about body position and body movements. This allows us to maintain balance with our movements, track objects with our eyes, and complete other complex actions. How exactly the vestibular system works is a bit complex and beyond the purpose of the video, but in a nutshell, the inner ear interprets our position in space in a coordinated effort with the eyes, muscles, joints, and other brain structures. Now that we have a basic understanding about the ear anatomy and function, let's dive into the patient case. The day started off like any other. I was sitting at my computer station waiting for patients to come through the door. The patient in question came running into the door and, with a raised voice, said, "I have a bug in my ear." Now, this was not the first time I've heard the same kind of complaint, but I took it seriously, given that she was pretty frantic. The patient was checked in and triaged by the MA, and I walked in soon after. The patient reiterated in an even louder voice, "I have a bug in my ear." I calmed her down and reached for the otoscope to look in her ear. Sure enough, there was a small cockroach in her right ear that was moving. Here is a video representing what I saw. I said to her in a calm voice, "Yep, there's a bug in your ear." The patient began to moan, "Oh no!" I told her not to worry and that I would be able to get the bug out of her ear, no problem. I laid her down on her left side and advised her to stay still while I gathered up the equipment I needed. This was the first time I had ever seen anything like this in my career. I've pulled other objects out of patients' ears, like Q-tips and other plastic items from patients' ears, but this was a completely different thing. And I I knew that because I had never seen anything like this or had done anything like this, I was concerned that I wasn't going to be able to do it. Um, but I mustered up the courage to move forward and to try my very best. And so before I walked into but when I walked out of the patient's room, I made sure that I read everything that I could read about this topic and memorized the steps before walking into the patient's room again. The supplies that I would need included lidocaine 2% solution, alligator clamps, and an otoscope. Thankfully, the woman had a larger than normal opening into the external ear canal. So I had no problem visualizing the bug and could avoid causing any damage with my instruments. I first poured the lidocaine 2% solution into the patient's ear. Lidocaine is a local anesthetic medication that numbs the area that it comes in contact with. I used lidocaine for two reasons. One, I did not want the patient to feel any pain while I was trying to get the bug out, i.e., the bug struggling or my instruments moving inside her ear. Two, so that I could kill the bug with the lidocaine before taking it out. I let the lidocaine solution sit in the patient's ear for a couple of minutes, and then I used my alligator clamps with otoscope light to grab the bug. Here is a video representing this moment. The patient was instantly relieved and said, "Thank you, thank you, thank you." I said it was no problem. I asked the patient to tilt her head so that the lidocaine could come out of her ear. Once the lidocaine was out of her ear, I rechecked the ear with the otoscope to ensure that there was no internal damage to any structures. Thankfully, there was no internal damage and no bug parts remained. She was very thankful that I was able to remove the bug from her ear, but she also wondered how this could have happened in the first place. Research shows that when it comes to bugs going inside of a patient's ear, most likely it is accidental or opportunistic. If you think about the ear canal, it is a dark, warm place for insects to hide. So naturally, they may find their way into the ear and subsequently become stuck. However, bugs are not actually attracted to the ear in any particular way, and bugs are not attracted to earwax by any means. So I prescribed ofloxacin topical solution to be placed in the ear to prevent infection. And I advised the patient to come back to the clinic in 2 days for follow up monitoring. Once the bug was out and I was done with the patient, I felt like I was on cloud nine. It was definitely one of the most memorable moments in my urgent care career up to that point. Um, I saw the problem. I read about the problem, I read about the solution, and I was successful. I was elated. The whole day I was very happy that I was able to um, take care of this problem for the patient. There was a problem, there was only one person who can get it done, and I accomplished. I was very, very happy. So what if you find yourself in the same situation as this patient? Let's say you feel like there's a bug in your ear, or you feel like something got stuck in your ear. What should you do if you're at home? Um, the best advice I can give you is not to do anything. Don't put anything in your ears. Don't try to get it out yourself. If you try to get it out yourself, you're going to make things worse, guaranteed. So get yourself to an urgent care or an ER right away so that way it can be taken out safely and under the guise and care of a physician.
Stop it. Get some help.
So that's the end of the video. This was a very interesting case, and I hope that you found it informative and entertaining. Um, my question for you is, before we go, have you ever had a cockroach or a bug or anything stuck in your ear? And what was your experience in getting it out? I'm curious to see how many of you have gone through something like this before, and I want to hear from you. So let me know in the comments below. I will have more videos coming out soon that discuss all types of different topics, including the time where I used to smoke. That's right, I used to smoke. Not very proud of it, but I did. And I'm going to have a video discussing blood pressure coming out shortly. So please be on the lookout for that. Please like, share, subscribe, and comment on my videos as they help me to make more videos for you guys to see. Thank you for watching, and I will see you in the next video.